You're listening to a podcast of Your Pet Matters with me, Dr. Michael Tokiwa, Saturday mornings at 10 a.m. on 1077thebronc.com.
Your pet is an important part of your life, and Dr. T knows how to take care of your best friend. 107.7 The Bronx presents Your Pet Matters with Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blouenberg. Every Saturday morning, Dr. T offers intelligent and informative pet health care talk with just the right dose of bedside manner, exclusively for our furry friends. If you own a dog or cat and have a question about your pet's overall health, call Dr. T now at 877-900-1077. Your Pet Matters is underwritten by the pet wellness professionals of the Animal Hospital at Kingston and Blouenberg. Small hospital, big medicine. For more information online, it's barkmeowvets.com. That's barkmeowvets.com. The doctor can see you now. Here's Dr. Michael Tokiwa and this week's edition of Your Pet Matters.
Good morning and welcome to Your Pet Matters. I'm your host, Michael Dr. T. Tokiwa, and we have a returning guest here. And she's a lot of changes have occurred in her professional life since last we spoke. It's Dr. Kendra Pope, and if you don't remember her visit, she is not only a board certified oncologist. She has so many, dare I call them degree certificates in traditional Chinese medicine, and she's trying to do what I think is the future of blending Western with Eastern philosophies. It's integrative medicine. And when I was in late vet school and starting my career, this term just started there. So it's been there for a while, but to have someone actually doing it is, in fact, I really only know one person in Jersey. And so when last we spoke, she was actually working for a large referral hospital, and since I spoke to her last, she's now on her own, and I'm really anxious and happy to talk about that. So welcome, Kendra. Thanks for being on the show.
Thank you. So excited to be back again.
Yeah, and so for our listening audience, and it's been a while since you've been on the show.
I know,
time
it's crazy.
Flies. So why don't we rehash the past, and why don't you just talk about how you got into this profession,
Okay.
and then how it led to oncology and then integrative medicine, and then from a professional standpoint, you now have your own business, right?
Yeah, it's a baby business. About 12 weeks ago, I opened my own practice.
Congratulations, that's awesome.
Thank you.
That's
yeah,
awesome.
Super exciting.
So how did it all start?
Yeah. So, and I think the road that we all travel to get to where we end up, which I'm clearly still on and will be on for a while now, it's really cool every once in a while to kind of like stop and turn around and look at where you've come and be like, oh, that's why that happened. And so, yeah, I'd love to do that. So the veterinarian piece was always innate, very decided upon for me from the time I was a little girl. So that one was easy, no brainer. I always knew I was going to be a veterinarian. And then at some point in time in vet school, once I realized I wanted to specialize, the rest of it kind of happened to me, I guess I'd say. So I went to the University of Florida, which has a very prominent integrative medicine program. The kind of forefather of veterinary acupuncture is there. He's faculty there. They do a lot with herbal medicine, rehab, and it's very accepted, I would say, for the university setting. And kind of at the same time, there were some things happening in my own personal life where the piece about cancer treatment and cancer and oncology really became something that I wanted to make a difference in. And so all of a sudden I found how beautifully, really, the two could blend together. When you have owners that get a diagnosis of something like cancer, and obviously this happens in people too, you really want all the tools in your toolbox, and you want everything that you have to fight. And it was really very serendipitous, honestly, that I took the path that I did, because looking back now, I realize how fortunate I am, because my board certification allows me this foundation for respect from my professional colleagues. It also provides me with the credentials to really know what it is that I'm doing, both from a Western and a unconventional perspective. And it gives me the training to create appropriate, respected research so that we can start to really promote the use of all of these tools in the toolbox. And so, I feel like there was a larger hand in all of this that, kind of pushed me down the road that I was going. And I feel lucky to be here now. And so now I found myself realizing that the best place to do that is kind of on my own, in my own way.
Well, let's talk about that. Do you want to talk about that larger hand? What do you mean by that?
Yeah. So, as a holistic practitioner and as someone who's spiritual, and that doesn't necessarily mean a certain faith. It just means that you kind of believe that you're here for a bigger reason. You're here to serve a bigger purpose. You kind of, feel that sometimes there's someone who knows better than you. That's putting you in the right direction.
Other than your parents, right? Other than
mom and dad. Yeah, absolutely. And, whoever you call that person at the end of the day is whoever you call that person. And I do feel like, although there were obviously conscious decisions made on my part and who I am, I think that I feel most fortunate every day because I think that I'm finally starting to really serve the purpose that I was put on the earth to do by blending these two things. So I feel very lucky.
Just out of curiosity, how do you feel about, and I can say this because I'm the old guy. You're the young and up and coming vets that I get to interview. But as the old guy, I find that I'm always following my gut now.
Ooh, yeah.
The response. And so
yeah.
From a spiritual standpoint, do you find that when those moments in life hit you, you had this little inner voice or whatever saying, either this is wrong, right? Or this is not where you need to be, or this is where you need to be. Do you find that played a role in a lot of your decisions?
It's so funny. I feel like this is not just a professional thing, but this is like, life decision things.
Absolutely.
It's so interesting that you're bringing that up because, especially as scientists, and especially as doctors and as very Western trained people, I think that it is in our nature and it is what we do every day is to overthink and to make decisions with our head. So it has absolutely been a challenge for me to kind of shift because you're absolutely right. When I was getting to the point where I was deciding whether to stay in private practice, working for a bigger entity, or whether to take that big jump and just go into the unknown and do it on my own. Yeah, you had to really listen to that inner voice and be like, it's got to be okay. It's going to be okay. You're going to be all right. So yeah, I think that, yes. And sometimes you have to turn the noise down in your head so you can turn up that volume inside. But yeah, I agree with you. It has been getting easier with age as well. Yeah. You start not to care as much about all the other noises and you listen to your own a little bit more.
Well, let's talk a little bit about the practice. It's based in Red Bank, right?
Yeah, it's in Red Bank, New Jersey. Yep. Mm-hmm.
So, and I've seen pics of it, and if you haven't, so it's go to drkendrapope.com. And you'll be able to then see images of her place, and next time we do this show, we'll do it from your place.
Oh yeah, that'd be awesome.
And we'll have everything going. I pictured like really cool music playing and everything like that.
Yes.
We're sitting on the floor cross-legged. As long as I can still do that, we'll do that.
Totally. But there's floor pillows. You're good. Everything. Yep.
But tell us about this place. So why did you pick Red Bank? And then, location and how's the clinic actually set up?
Yeah, so I would love to talk about that. So I stayed in Red Bank, New Jersey, because when I was choosing to leave my previous private practice, I had a huge case following already, and I didn't want to go too far. Red Bank is also in Monmouth County, New Jersey. It's probably one of the best locations for what it is that I do. It's a professional district. There's a lot of open-minded people. It's a suburb of New York City. So it's very accessible to where I live and for people coming out of town. So it definitely turned out to be a great location for me. The practice is awesome. So if you can't hear me smiling through my voice, it just is it's a joy to walk into every day. So the space needed to be for what it is that I do. I needed to not feel medicinal. The patients needed to walk in, and they needed to feel like they were in a safe space and that it wasn't threatening and it wasn't scary and bad things weren't going to happen there, because there is a lot of evidence, not just what spiritual people talk about, but there is a lot of evidence that those physiologic responses do have some effect on their ability to heal. So when you're talking about doing things like acupuncture or herbal medicine, or I work with an energy worker, someone who practices Reiki, when you're talking, even massage therapy, when you're talking about those types of modalities, you really need the environment that's conducive for those types of procedures. So it's a small space, 3 exam rooms. There's no cold exam tables. There's really not much medical type of equipment at all. There's a lot of, there's couches, there's soft chairs, there's floor pillows, there's carpets. Inexpensive, so when they get damaged, they just get thrown out. Because we are dealing with animals. And then the chairs in the exam rooms, my quote-unquote exam tables, are tufted ottomans for everyone to sit on.
Okay.
So, and absolutely like what you said, you know, there's the calming music in the background, there's aromatherapy, and it's quiet. It's very quiet. The phone's not ringing. There's no paging. There's not loud noises. There's no beeping of syringe pumps and fluid pumps. So it's meant to be a space where both the owners and the patients, when they come in, they can just relax.
I mean, I want to go there and relax.
Yeah. Come on over. It's awesome. It's great. It's really pleasant.
Well, from a business standpoint, so when you mean there's no phones ringing, so where is your phone system, and how did you separate that?
Yeah, so it's just on mute, you know. So when people are calling, they they will leave messages and then we'll get back to them. What I'm trying to do too is kind of take, you're always trying to increase efficiency, which I know that you know, Mike, from your business too. And so owners are allowed to schedule appointments online, and there's an appointment scheduler for them to go on to and take care of that themselves. And with prescription refills, it's an online store. So, try to take some of that component of the office work that takes the doctors and the staff away from interacting with the patient to do it online if you can. And granted, I'm new, and so I'm still growing, and at some point in time, I'm sure that'll have to change. But right now, it's nice because you're really able just to be present where you are.
That's great. And what we have to do, we have to take a short break, and then we'll come back and we'll talk more about integrative medicine. So we'll get Dr. Pope to talk about integrative medicine and how she incorporates that into what she does right now. You're listening to Your Pet Matters on 107.7, 107.7, thebronx.com.
If you own a cat or dog and have a question about your pet's overall health, call Dr. T now at 877-900-1077. Now back to the premier radio show in Mercer County for helpful advice about your pet in this week's edition of Your Pet Matters.
Welcome back. And if you're just joining us, my special guest today is Dr. Kendra Pope, and she has her own integrative practice. So she is board certified in veterinary oncology, and she does, what don't you do? You do acupuncture, you do
herbal medicine.
You said you work with Reiki.
Yep, we have a massage therapist that comes in, nutrition.
And so it's all a way of blending Western medicine, which we call traditional, which is your standard hospital setting, so to speak. She's gone away from that, and she's taking that knowledge from an oncology standpoint, but also blending it with a lot of traditional Chinese medicine and other Eastern approaches. And so for our listening audience, Kendra, can you just talk about what integrative medicine is, and maybe even talk about a great case that you had that you integrated stuff and had good responses and so forth?
Yeah, sure. And I'd love to. And, these modalities are being used in my patients. A large portion are cancer patients because of, my oncology training. But, you'll see, obviously, as I explained kind of what integrative medicine is and the modalities behind it, about why it would work for any patient, either with any chronic disease or just patients that are seeking wellness. The owners, are interested in wellness for their pets. So terms that are more common to pet owners are things like holistic medicine, complementary or alternative medicine. Those are all words that have been around a long time, have been used a lot, and often can be interchangeable. But this word integrative medicine has really been developed originally in physician-based medicine to distinguish the use of these complementary and alternative modalities, not as an alternative to or in placement of, but alongside and in conjunction with. It's also meant to be very personalized. So every case is different and every case uses different tools. And it's also meant to be very collaborative. So, it's not just the holistic vet or just the conventional vet. There's all the members of the team. And it's also really meant to be evidence-based when possible. So, as a Western culture and as a Western doctor, we are all trained to question everything and to make sure that the evidence is present before we recommend treatment. Any veterinarian doctor, any of us know that a lot of our clinical practice, unfortunately, that's just not reality. It gets us to a point, and then the rest of it is very educated, informed decisions based on our clinical experience. And so oftentimes, even in my specialty of oncology, that's the reality. We're limited to a certain point in what we know, and then what we do thereon is based on our clinical judgment. And so an integrative approach is really meant to be that. It's informed by evidence when possible. It's always collaborative. It's personalized. And kind of my favorite principle of integrative medicine is that the practitioner embraces these modalities in their life all the time. And so I have to walk the walk. I can't just talk the talk. And I really like that. There's some accountability for me as a practitioner that are providing these healing modalities to not sabotage myself and to enforce some self-care. And so that I think is probably my favorite piece about it.
Okay, well, let's go into that. So do you actually do acupuncture on yourself?
Yeah. So, it's interesting because as you start to learn about these different modalities, and since I was on the show last time, I actually started training in Western herbal medicine, which is really fascinating because they're the herbs that we're most familiar with, as a Western culture. They're things like turmeric and milk thistle and ginger and echinacea. And so they're the ones that we're like, oh, yeah, I know about those. They're also used more often as single herbs than as formulas like Chinese medicine is. So my medicine cabinet has turned into an apothecary. When I get a cold, there's lots of teas and tinctures. When I'm not feeling well or when I'm stressed, there's practices like meditation or yoga. And so it does, it forces you to recognize that your body was created to do a lot of things itself. And so sometimes you need that medication, that antibiotic, that pain reliever, whatever. And other times you can be like, oh, okay, my body's warning me, you need to slow down. You're doing too much, or you're pushing too hard, or you're running too often and not giving yourself a break. And so that part about just having a little bit of more awareness, I think is good for all of us.
And do you have a neti pot?
Yeah, I do. Saline nasal sprays. Absolutely. Yes. They're great. They're disgusting, but they work.
I don't have the guts to use that yet. I don't have the guts.
They make like the like super powered saline ones. You can start with those instead.
That is it's so funny. I had to ask that question, but I knew the answer.
Yes. You knew I'd have one. Absolutely.
But from a standpoint, this is where so I'm not trained, and when my clients start asking me questions about this, it's like, I don't know, it's one of those types of things. So what would your best advice be for those day practitioners out there who don't really have the experience? And my concern is that some people are just going and buying this stuff from unknown sources, right?
Absolutely.
And what sort of complications and ramifications that would have. But what would be the advice you could give a day practitioner such as myself when clients start bringing this stuff up? And I'll be frank with you. There is a holistic vet. I don't even know their name in the area, and it's strictly holistic. So it's the other extreme. And I do find that I've come across a couple cases where it wasn't adequate is the best way to say it. So could you address those types of issues with our audience?
Yeah. So I think that that's probably, as a pet owner, I think that what I have heard and what literature shows when, we've surveyed these pet owners and it is mirrored in human medicine. It's the same things that you hear the same things is that owners get frustrated because they go to their primary care or their whatever doctor it is that they're seeing, their specialist, whatever. And they're interested in seeking these modalities, and their specialist doesn't know. And they warn them not to do it because we have no evidence. So then what happens is that they are still very, very interested in it. They want to feel empowered to help, so they do it on their own. And you're absolutely right. Then that is what happens. From what I've heard, so that the pet owners are aware on the professional side of things, what our colleagues' biggest concerns is that they feel that owners who seek out this treatment will do it not in conjunction with traditional medicine, or they will seek out a conventional practitioner that will take them off of all of their conventional medication, and then they will delay the conventional treatment, and then they could end up in a really bad spot. And so I think that what my goal is in my career and what I would encourage all practitioners, conventional practitioners to do is find someone that they trust. And there are many websites of these professional organizations, whether they're a nutritionist, a chiropractor, an acupuncturist, an herbalist, that can give you somewhere to start to see if there's someone in the area that at this point, there is no one governing body for these types of specialties. It's something that is being worked on actively at the moment, but it'll give you a place to start to see that these people have had some type of training. And if you can find someone in an area that you can trust, that you could say, hey, what do you think about this? Or what have you heard of this? So that you know it's not all, witches' potions and snake oils, that, oh, maybe this is something that can be used in conjunction, or what have you heard? There's also although there's limited literature, there is things coming out. And if you search, what I always encourage my colleagues to do is if you want to look up a botanical, use its Latin name in PubMed. And you usually can find a lot of, at least, laboratory studies. Not a lot of them are clinical research, but laboratory studies to show you, oh, okay, milk thistle has been shown to do X. Or, oh, yeah, turmeric has been shown to do Y. And so sometimes those are at least places for foundations, along with really just building a relationship with a colleague that you can trust to ask these questions to.
And you're that colleague.
I'm happy to be. Yeah, absolutely.
And so let me clarify. So your current practice, you're willing just to do holistic consulting too, right? Not we can take the oncology out of the equation. Is that correct?
Yeah. So I'm actually going to practice. And it was interesting because they asked me to speak about that specifically because they were referring cases to me and they were giving me some feedback that their clients were concerned to come to me because their pets didn't have cancer and they didn't know why they were coming to see an oncologist if their pets didn't have cancer. And so the kind of analogy that I like to make is that there is an integrative physician. His name is Andrew Weil. He's kind of like the forefather of integrative medicine. And he talks about integrative oncology and what that is. And this applies to all chronic conditions. The integrative oncology piece, he says, cancer is like a weed. And when your conventional treatment, so whether it's cancer, heart disease, liver disease, kidney disease, autoimmune disease, dermatologic disease, whatever it is that you're treating, that's the weed. And then the integrative portion focuses on the soil. And what the goal is to make that soil either as inhospitable or hospitable based on what you're treating. And so it's really the support to the conventional medicine. And so it doesn't matter if I'm an oncologist because my holistic training isn't just for oncology patients. I just offer that additional layer of conventional treatment for those cancer patients. What I do the best is focus on that soil for whatever disease or wellness it is, because if you're just focusing on health and wellness, then you create the healthy soil to make it grow. If you're focusing on treating a disease, then you create soil that helps to make it go away.
That's a great analogy.
Yeah, I love it. When I came across that, I was like, this is beautiful because I think it's just very descriptive of exactly what it is that we're doing. And yeah, of course, sometimes there's things that you use that the hope is to directly treat the problem. But a lot of times what it is, it's supporting you're supporting the body's innate ability to right itself, homeostasis, balance, whatever it is you want to call it. And so, yeah, what I've realized is that because of the amount of kind of training that's involved and people's interests, there aren't a lot of oncologists in the United States that have this kind of holistic knowledge. And so what I've found is that a lot of my conventional colleagues trust me. And so we work together often to do consulting. So I do distant consulting for oncology cases all the time that are undergoing cancer treatment, whether it's in California or Virginia or Florida, wherever. We have a relationship, and because of the technology, there's no problem. So we can do what you and I are doing right now.
No, that's awesome. So what we'll do is we'll take a short break, and then we'll come back, and I would like to just walk through what we'll start with the oncology. So how you're finding that the integrative component is really benefiting cancer patients. So you're listening to Your Pet Matters on 107.7, 107.7thebronx.com. We'll be back in a second.
A healthy pet makes for a happy home. Let's try to make your pet's home the happiest out there. Welcome back to Your Pet Matters with Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blauenberg. Listen to Your Pet Matters online at 1077thebronx.com or via your smartphone. Search and download WRRC1 in either Google Play or the Apple iTunes Store.
And we're back. And if you're just joining us, my special guest is Dr. Kendra Pope. And what makes her unique, not only as a person, but in the veterinary profession, is she's boarded in oncology. So she's a cancer specialist, but she has lots and lots of experience doing traditional Chinese medicine approaches, and she's integrating that. And so she's created an integrative practice. So she's basically a leader in the field of coming together and bringing the Western with the Eastern philosophies. And if you listen to the first segment of the show, she actually described her practice as being less a practice in appearance, sight, sound, and smell, more like just a relaxation area with very little medical equipment there. But she is performing incredible things there. And that goes to show your background, because I know that you're involved in being the class president of your class, and you had this drive for doing things and being at the forefront of everything, correct?
Yeah, absolutely. I've always been someone that it's been a part of me to want to affect change, and it's been a part of me to want to make a difference. And so, I definitely have always been someone that has been a mover and shaker. So it's been, I feel very fortunate now to kind of be doing it in something that I love so much. But yeah, absolutely.
Well, so why don't we talk about, if you can, just talk about a typical case that you had that, why don't we start with the oncology? Because if you're just tuning in, so typically if your pet is diagnosed with cancer, then what happens is we definitely get the input. If not, you're sent to a referral center or a specialty center where you're actually going to have an exam with your pet with an oncologist, and they're going to give you your options depending on what type of cancer has been present there, whether it's a surgical intervention followed by chemotherapy or radiation therapy or what have you. And so Kendra's definitely been trained in that. But as you know, like, some cancers have tendencies to wear the body down. Some of the treatments have tendencies. A big misinformation, I would say, in the pet world is a lot of the pet cancer therapies aren't as taxing on their bodies as the human therapies are. So if you're in a situation, we have this discussion a lot in the exam room where you have a human experience with cancer treatments can be completely different or much different from a pet experience, but there are still side effects. I mean, you're taking toxins, you're taking radiation therapy, and so forth.
Yep.
So, and I'll let you go because I don't want to, say something wrong.
No, that's all true.
But so how do you incorporate these processes with your cancer patients? these
Yeah.
integrative processes?
So I think that, the majority of my owners, and I know with you too, with what they're seeking is when they get the diagnosis, they want the miracles and they want the cures and they want the special potion or mixture or remedy that's going to take it all away, make it go away. And yeah, that's what we all want. And sometimes there are those miracle cases, and I have a couple stories like that. But the majority of what I really counsel owners about is that you're absolutely right. This is a chronic disease that's affecting their patient. This is the treatments have effects. They're not benign. And so our goal is to do everything we can to make their pet feel as awesome as possible for as long as possible and focus on quality of life. And what I always tell owners is that I promise them that their quality of life is going to be exceptional, because I think that that's where the integrative approach really excels, is that it allows us to give them not just a good quality of life, but a great quality of life. And then it's a bonus if they live longer, if their cancer is in remission longer, if the cancer doesn't spread, if it doesn't come back. And so that's just icing on the cake. So kind of the typical scenario and what it is that we really do for these cancer patients is, they have their conventional oncologist. I sometimes serve as that, not as much now as I used to, because, my colleagues are exceptional at what they do. And so I like them to do what they're exceptional at. And so most of my patients have their medical oncologist or their radiation oncologist that are treating their cancer conventionally, whether that be with chemo or radiation or immunotherapy, whatever, surgery, whatever it is. And then I'm part of the team too. And what I do is I counsel the owners on all the other awesome stuff that we can do. So for a lot of patients, we talk about food. So there's a lot of propaganda out there about what do I feed? Do I feed grain-free? Do I do this ketogenic diets? That's another hot topic. Do we stay away from carbs? Is sugar bad? Do we do fresh food, raw food, cooked food, bag food, kibble food? There's all these things. So we talk about what that looks like. And for a lot of my owners, I do counsel them to feed some type of fresh food. In people, what they try to get them to do is preservative-free, minimally processed, whole food nutrition. We know what's good for us. And so I work alongside a clinical nutritionist, and a lot of times we'll counsel owners on how to do that and what that looks like. So food is one big part of it. The second big part of it is what can we do to alleviate side effects of chemotherapy and help the immune system? So we'll talk about modalities like acupuncture and how they can maybe be utilized. In human medicine, there's extensive research that shows acupuncture benefits cancer patients in fatigue and anxiety and side effects of chemotherapy, nausea, vomiting, diarrhea, decreased white blood cell counts, decreasing scarring with radiation therapy. It's really extensive. And unfortunately, up to this point, there's no clinical trials in animals with cancer, but fingers crossed, one of my clinical trials I'm working on is going to prove that, and hopefully it'll be published in the near future.
Awesome.
Yeah. And then obviously the other big thing is supplements. There's so many out there. There's so many wonderful plants that can be used in so many different ways, but they aren't safe just because they're natural. And so we counsel owners on how to mix them together, when to utilize them, who is okay with chemo, who isn't okay with radiation, and when we can add them in. And, even some experimental treatments, things like high dose intravenous vitamin C infusions, some things like mistletoe injections. There's all different interesting things coming down the holistic, pipeline that are being tried in human medicine. And so, we try to kind of offer owners whatever we know is out there that's safe and that has had some evidence that's okay to try. And even, counseling them with the pet's overweight to try to keep their weight in control, decreasing stress in their own life as the caregiver, seeking out things like energy work or massage or whatever. So it's extensive. There's a lot of options. And so as you can see, there's a reason that I'm another teammate on the team, because it's a whole nother specialty in itself. And what we do is really just create that foundation to keep those pets as healthy as possible as they're dealing with their diagnosis.
Do you have an open space beside where your practice is right now?
You mean other than the building?
Yeah, is there like a business that's going out of business beside you that you could just like take that space over? And the reason why I'm saying this is you need to have a human model where you'll take their pet, you'll treat them, and you'll have the human being treated too. You know, just go over there, you know, grab a Starbucks because that's 2 doors down, and then I want you just to chill in that room, and then you know, so and so will come in, we'll deal with you while we take care of your pet.
Well, and there's so much evidence too about that human-animal bond and the pet therapy piece, and all of them go together so nicely. It's absolutely on my radar. And that is like an ultimate for me, you know, non-species specific wellness center where whether it's cancer or not, or if it's just wellness together, regardless of the disease condition, I think that that would be amazing.
I know a guy. We'll talk.
Perfect.
My dream was to have a Starbucks beside the practice with pneumatic glass doors.
Did you get one?
No, I did. It's like, hey, just go over next door, have a coffee. We'll take care of Fluffy, and everything will be good. But I think your business model is much better. But in the couple minutes we have left for this segment, do you get negative feedback from the profession? Are there some practitioners out there that are just going to forget it? And I guess along with that question is, that's a very bold statement you make, that we're going to guarantee your pet has an awesome quality of life going through. And so clearly this stuff is working great, right? You know what I mean?
Yeah,
so how does it balance, you know, with the negativity that you may experience and stuff?
Yeah, absolutely. You know, and it is a bold statement, and, you know, it doesn't always happen. You know, there's those patients that unfortunately succumb to their disease, or something doesn't work, or they still are unwell, even though we try. But that's always our goal. And as far as the negative feedback goes, you know, it's absolutely trying. And like anyone who's ever been in a specialty that's maybe not well accepted, or new and up and coming, or kind of shakes, you know, the norm and makes people uncomfortable, those people will tell you that they face adversity. And I think that I've experienced it, fortunately so far, it's been more of non-support than it has been of adverse disdain or anger, or thinking that I'm hurting patients. That probably comes from the fact that I do truly practice an integrative approach. I am not purely a holistic practitioner. I use all of the tools in my toolbox. But some practitioners, holistic practitioners, will tell you that they don't feel that the modalities work as well if you utilize both of them. And so maybe, you know, my other colleagues would have some arguments for me to kind of on the line that I stand to. And I imagine maybe that'll change as I go through my career, which direction I move closer towards. But I think that outside of all of that, what my goal is, and what I try to do every single day, is take all of the information that I have, which granted I've spent a long time educating myself on, and granted I have a lot more to learn. And I try to make the best decision for the patient at every opportunity. And at the end of the day, if you've done your best, that's really all that we can ask for. And so, you know, I think all of us as professionals have a duty to continue educating ourselves and making sure that we're up to date, and making sure that we're still practicing the most advanced medicine as we can. And as a holistic practitioner, it's no different. You know, there's always new information coming out. And honestly, as a specialist, I've been told by one of my holistic mentors that it's not just something that I should consider, but that clinical research is a duty of mine as a specialist to publish. And so I think that that's another thing that I would offer to my colleagues that maybe have some criticisms, is to say, well, what research are you doing in your field? Because I'm researching in mine. And so I think that that is really my goal, is to prove for my colleagues that this is legitimate, and that it is something to be considered seriously.
That is sage advice. That whoever your mentor was there, kudos.
Yeah.
That's great.
Yeah.
No, that's awesome.
Mm-hmm.
Okay, with that, we'll take a short break, and we'll come back talking to Dr. Kendra Pope. You're listening to Your Pet Matters on 107.7, 1077thebronx.com.
If you own a cat or dog and have a question about your pet's overall health, call Dr. T now at 877-900-1077. Now back to the premier radio show in Mercer County for helpful advice about your pet in this week's edition of Your Pet Matters.
Welcome back. I'm your host, Michael Dr. T. Tokiwa. You're listening to Your Pet Matters, and my special guest today is Dr. Kendra Pope, and we've been talking a lot about integrative medicine. Dr. Pope recently, 3 months ago, opened up her own practice. You can find her as drkенdrapope.com. Just look for her, and you'll find probably the most zen looking practice you're ever gonna see. That's my opinion of the images I've seen. And she's really trying to bridge the gap with Western and Eastern traditional medicines, and she's trying to open up the minds of both practitioners and pet owners about the benefits that bringing the two modalities together have. I'll be quite frank with you. I don't think one or the other is good. I think the best is a combination. I think that we find difficulties or issues when we just go one way or the other, and that's why I asked you last time: are you getting any negative feedback? And I think that your answer is great, and that it's the people who are hardliner left or hardliner right are the ones that are probably giving you the most issues, if anything, or most reluctant to look at both sides of the equation. And in today's day and age, that's perfect, right? You have the Republicans and the Democrats.
Totally.
You're that one in between. You're the much needed mediator we need in this world right now. So I think that's awesome. But where do you see this going? In the future, what's not only the vision for your business, but where do you see integrative medicine? You think it's just going to be completely one part of the practice as we go along in the profession?
Yeah, I think it's interesting when I talk to, holistic mentors of mine that have been doing these things for 40 years, and how much further they think that it's come than it was at that time. And then I look at it as I've been, now kind of doing it the way that I wanted to for just 2 years. And I feel like we have so far to go. If we use human medicine at all as kind of like a marker, there is a Society of Integrative Oncology that's been around for about 15 years now. And traditionally, veterinary medicine is about 20 years behind. And so, maybe in another 5 to 10 years, we'll start to see professional organizations of specialists kind of blend these together. There has been something recently that has happened that you've probably heard about, where there is a movement in veterinary medicine to create a specialty board certification in specifically botanical medicine, so herbal medicine. And the other veterinary professionals have not been really supportive of that. The specialists in particular, they don't seem to agree on where this organization should be housed, and the rigors that have been proposed of the residency training. And so I think it's going to take some time to get there, and probably that will be a huge step in the right direction for standardizing training so that other veterinary professionals know who they can trust and know that they've gone through certain coursework to be called the specialists that they are. So that is probably in the near future. It's been something that's been going on in the holistic community for a while now, and very recently has had a lot of exposure. So that's probably where that piece is heading. It's interesting because I feel like, we had this resurgence of holistic medicine and going all natural, especially with the millennials. A lot of my clients are millennial clients. They're educated. They're, they usually don't have families yet, so their pets are usually their children. And so a lot of them are seeking these out because they want to know what else they can do. And so it's definitely trendy now to be holistic. It's trendy now to be natural. It's trendy now to, take care of yourself well. And we've realized through years of being very Westernized that maybe that's not the only way to be. And so I do think that we're going back to our roots, so to speak, in some of those things, and realizing that Western medicine isn't everything, and that sometimes it still does miss places that need to be filled with more natural options. And so, I hope that it goes in a way that's more palatable for our colleagues so they can become more accepting of it. But at the end of the day, I think what everyone realizes is that owners want it. And so it's here, whether they want it or not. And now we just need to figure out a way that everyone is comfortable using it.
And I think you make a great point about millennials. I read an article once that they're actually designing their homes around their pets, and I think that the best example is when you do see those kitchen ads about having that area where the dog or cat could just sleep,
the
right?
Dog bed
built into the kitchen cabinets, and it's funny because when I do get millennial clients in, I don't want to be stereotypical here, but same-sex couples are great pet owners. Millennials are great pet owners. It's those two categories that we get that I'm just going, oh yeah, no, they're great pet owners. Things like that. But yeah, it was funny because I had to do. There's a little millennials came in the first time. They had a really nice little Chihuahua. So I was like, this is awesome, right? This guy's not trying to kill me, right?
Yeah.
What I had to do was anal glands. And so it was a big discussion. They've never had dealt with anal gland issues. And it was so cool.
No.
But, and I'm going through, yes, they're at 4 and 8 o'clock. And I'm just grabbing it and going, oh, this one's really full. And they're giving me trouble, right? And I go, your right one's giving me a little trouble. The couple was great. And the dog was phenomenal. So it was really good. But yeah, no, I totally agree with you. I think that this is the way it is. And thoughts that were going through my mind when you were talking were, in school, do you actually see that integrative medicine or even a holistic is going to be part of the curriculum? Just so that it just creates an awareness, not only just that, it'll be part of when we're sitting there and we're sitting there, we look up plum, we're looking up the drug, but we're also thinking, okay, what kind of herb could we supplement this case with, this upper respiratory case that would, with the help situation like that. I think that's what the future is going to be. And the other thing going through my mind is, for a practitioner out there, whether they're a specialist, whether they're a day practitioner, what sort of advice would you give them of how to actually just get started into trying to incorporate or researching or even studying for this approach that you're working on?
Yeah, and that's interesting. Both of those things are interesting, and there were some things on the listserv about that recently. So actually, human medical schools do much better job than veterinary schools of exposing their doctors. So there were some stats that showed in veterinary medicine, there were like 30% of veterinary schools have any exposure to integrative medicine, whether that's acupuncture or herbs or whatever it is. Whereas in the medical schools in the United States, it's closer to 80%. So we are definitely not doing a good job of exposing our students, even at this day and age. And that's also a movement that's been made by the holistic medicine, organizations to increase that. So I think you're right about that. And then as far as, the second piece about how to incorporate it and where do you get started, there was a question on the holistic listserv from someone who wanted to jump in, and they were like, well, which pool do I go to first? Do I go acupuncture? Do I do herbs? Do I do chiro? Do I do energy work? Do I do whatever? And it's vast, it really is. And it's a whole nother world. And I think most people find acupuncture probably the most palatable and the easiest to get involved in. There's a lot of different courses, either very based in the theory of Chinese medicine or very Western and evidence-based. So you can really take a course in however it is that you want to approach it. And it's probably one of the most versatile modalities, I would say. Herbs too, they're extraordinarily versatile, but acupuncture really can be used for almost anything. And so I think that's where most practitioners get started, either themselves if they're interested in getting involved or bringing someone into the practice. And then from there, most acupuncturists either have some exposure to Chinese herbs or maybe even Western herbs, and then can kind of take it from there. So that's probably the easiest way to get started.
No, that's great. And I got to tell you, Kendra, time's up.
Oh, my. We always go so fast.
I know. There's so many interesting things to talk about. It's always great talking to you about things like this. And, so other than drkendrapope.com, is there another way? Do you have the phone number memorized for your practice? So
Yeah,
people get
I
hold of you?
do. I do. I can give that as well as social media. So drkendrapope.com, my office in Red Bank, you can reach me at 732-268-8553. And you can follow me on Instagram, Facebook, and Twitter. All the social media handles are drkendrapope.com. And as the business grows and develops, there'll definitely be more content and media and information and videos and all of those fun things. So yeah, looking forward to building those clients and all those patients.
And I'm looking forward to the part beside you doing the human holistic
Yeah.
stuff. Yeah. It'll be Dr. Kendra Pope Wellness Facility. That's
Yeah,
what it's
exactly.
gonna be.
It needs a catchier name than that, but yeah, definitely. For
No,
sure.
that's awesome. Well, thanks so much for being on the show, and best of luck with this. I know you're just 3 months in, but I mean, the sky's the limit, and I think that you've got this. Clearly, you've got the passion, you've got the drive, and you're still young, which is awesome. 'cause
Woo!
you got
I got the
energy, so,
time.
you know, just get that neti pot out when you need it in the winter
Exactly.
comes.
It'll be good. Absolutely.
Okay, well, it's great
Awesome.
talking to you, Kendra. Take care.
You too. Bye-bye.
And remember, everyone, love your pet like they love you, unconditionally. Have a great day.
Thank you for seeing our doctor this morning. You have been listening to Your Pet Matters, the #1 pet healthcare show in Mercer County. Your follow-up appointment is next Saturday at 10 a.m. Tune in to hear Dr. Michael Tokiwa of the Animal Hospital at Kingston and Blauenberg, along with his expert guests as they share their knowledge and experiences to help your pet live a long, happy, and healthy life. Want to catch up on Dr. T's advice? Click on the Your Pet Matters page at 1077thebronx.com. Your Pet Matters is underwritten by the pet wellness professionals of the Animal Hospital at Kingston and Blauenberg. Small hospital, big medicine. For more information, it's barkmeowvets.com or like the Animal Hospital of Kingston and Blauenberg on Facebook. Tune in next week at 10 for another edition of Your Pet Matters exclusively on 107.7 The Bronx and 1077thebronx.com.